So there are different kinds of eating disorders, and there are many different factors that lead to an individual developing an eating disorder. There are biological contributions, and there can be genetic predispositions. So you might have a history in your family. There are social factors. Exposure to images around low weight have been associated with the development of anorexia and bulimia. And psychological factors. There are certain individuals and personality styles that may be more likely to develop eating disorders. Because they're very complex disorders, they're often stigmatized. People can have difficulty talking about them. And so if you do struggle with an eating disorder, or you're concerned about someone you love struggling with an eating disorder, it's important to seek out professional help. These conditions can have very serious health consequences. So signs of eating disorders can vary depending on the type of eating disorder we're talking about. People with anorexia and bulimia tend to be very preoccupied with their weight and their body image. Individuals with anorexia will often restrict their eating to the point of losing significant weight and having physical health consequences. People with bulimia will have periods of binging, eating excessively, followed by periods of purging where they try to get rid of those excess calories. People with binge eating disorder will often have emotional eating and periods of high intake, but don't necessarily have those restrictive periods. And then again, there are some folks that have kind of a restrictive food intake disorder, where there are particular types of foods or particular sources of food that they will kind of avoid. We have some information on our AHS Help in Tough Times website on where you can access resources.